If you are worried that something is wrong with your body, and honestly, if you clicked on this video, you already feel it, then there is something critical you need to know right now. You have been told that Sjögren syndrome starts with dry eyes and a dry mouth. And yes, those are real symptoms. But the women who get diagnosed the fastest, the ones who walked into a rheumatologist's office with actual answers instead of years of confusion, they were not the ones who complained about dryness first. They were the ones who recognized the signs that came earlier. The quiet signals. The ones that get dismissed as stress, aging, hormones, or anxiety. And today I am going to walk you through 5 of those early signs, because not one of them is the symptom you have been warned about. And if you recognize yourself in even 2 or 3 of these, what you do next could change the entire direction of your health story. Before we get into the 5 signs, I want you to understand something that makes Sjögren's so uniquely dangerous to ignore. The average diagnostic delay for Sjögren's ranges from 3 to 6 years, and in some cohorts it has been measured at closer to 8 or 9 years. 9 years of your life spent going from one specialist to another, being handed one partial explanation at a time, while a single underlying condition goes unnamed. One doctor treating your joints. Another one treating your exhaustion. Another one treating your nerve pain. Another one treating your brain fog. And nobody connecting the dots. That is not a failure of your body. That is a failure of pattern recognition. And by the end of this video, you will have that pattern. You will be able to see what trained eyes have been missing, and you will know exactly what to do about it. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Insight is 200,000 subscribers, and every single person who joins moves us closer. And if you want the full Sjögren's symptom map guide with visuals, symptom breakdowns, and additional resources, type symptom map in the comments and I'll send you the link to access it. Starting with your joints. Not your eyes. Not your mouth. Your joints. Here is something that surprises almost everyone who eventually receives a Sjögren's diagnosis. Joint pain and morning stiffness are among the most commonly reported symptoms in Sjögren's patients, and for many people they appear years before any dryness shows up at all. A large patient survey by the Sjögren's Foundation found that 81% of respondents reported joint pain as a symptom, making it one of the top 5 most commonly experienced features of this disease. And the cruelest part is what this joint pain looks like in real life. It is not dramatic. It is not the kind of swelling that sends you to an emergency room. It is the kind that makes you sit on the edge of your bed in the morning for a few extra minutes before your feet hit the floor because your hands feel stiff, heavy, and not quite yours yet. It is the kind that loosens up by noon and so you convince yourself it was nothing. You slept in a bad position. You overdid it yesterday. You are just getting older. Healthcare providers miss it too, because when they run a standard rheumatoid factor test it frequently comes back negative, and Sjögren's often does not show on those basic panels. A significant proportion of Sjögren's patients are seronegative, meaning the antibody tests that are most commonly ordered come back negative even when the disease is genuinely present. Research confirms that approximately 10 to 30% of Sjögren's patients test negative for both anti-SSA and anti-SSB antibodies, the 2 markers most commonly associated with the condition. That means for 1 in 10 to nearly 1 in 3 patients, the most basic autoimmune blood panel will not catch it. So if you have been told your blood work is normal and therefore nothing is wrong, that logic does not hold. Normal antibody results do not rule Sjögren's out. A rheumatologist experienced in this condition looks at the entire clinical picture together: symptoms, labs, eye testing, salivary gland evaluation, and in some cases a minor lip biopsy, not a single number on a page. If you have been living with joint stiffness that is worse when you wake up, that moves around, that has no clean orthopedic explanation, and especially if it comes alongside fatigue, write that pattern down. Your body has been trying to tell you something your blood work has not been trained to hear. If this is you, type the word joints in the comments right now. I want to see how many of us share this one. The second sign is one that almost no one connects to an autoimmune condition, and yet it is so common in Sjögren's that it shows up in 90% of patients according to the Sjögren's Foundation's own survey data. That is 9 out of 10 people. The sign is extreme, disproportionate fatigue. Not tiredness. Not the kind that improves after a full night of sleep. The kind where you wake up after 8 hours and your body feels like it never rested at all. The kind where a normal Tuesday leaves you needing to cancel Wednesday. The kind where other people around you seem to recover from the same activity in a day, and you need 3. Sjögren's fatigue has a very specific character. It is not proportional to your activity level. It hits without warning. It does not respond to rest the way ordinary tiredness does. And because it is invisible, because there is nothing to point to, no rash, no fever, no swelling you can show another person, patients are routinely told they are depressed, deconditioned, burnt out, or simply not managing stress well enough. What is actually happening inside the body is that the immune system is in a state of chronic, low-grade activation. It is expending enormous energy attacking the body's own moisture-producing glands, day and night, every single day. In many patients that immune activity extends well beyond the glands to the peripheral nerves, the kidneys, the lungs, and the central nervous system. That process is metabolically expensive in a way that nothing else quite compares to. Your body is fighting a war you did not declare and cannot call off, and the exhaustion you feel is the direct physiological cost of that war. It is not weakness. It is not a personality trait. It is your immune system consuming resources it was never meant to use this way. If your fatigue has been investigated and dismissed, if you have had a full thyroid panel, iron studies, a sleep study, and still nobody has a satisfying answer, then autoimmune testing that specifically includes an ANA, anti-SSA, and anti-SSB needs to be part of that next conversation. If you have been living with fatigue that no one has been able to explain, type fatigue in the comments right now. You are not alone in this. Not remotely. The third sign is the one that gets misdiagnosed more than almost any other early Sjögren's symptom, and that misdiagnosis can delay your correct treatment by years. It is nerve pain. Specifically, a burning, tingling, or numbness in the hands, feet, or face that healthcare providers frequently label as peripheral neuropathy of unknown cause, or attribute to diabetes, vitamin B12 deficiency, or poor circulation. But here is what the research actually tells us. Sjögren's syndrome is one of the leading autoimmune causes of a condition called small fiber neuropathy, which is a type of nerve damage that does not show up on a standard nerve conduction study or EMG. This is not a minor detail. It is the central reason so many people with Sjögren's-related nerve symptoms are told their tests are normal and sent home. You can have a completely normal nerve conduction study result and still have real, measurable, Sjögren's-driven nerve damage destroying the tiny fibers just beneath your skin. Research published in major rheumatology and neurology journals confirms that in Sjögren's patients with small fiber neuropathy, neurological symptoms can actually precede the Sjögren's diagnosis itself, meaning the nerves begin showing the disease before the glands do in some patients. The symptoms are often described with striking consistency. Burning pains, numbness, tingling, the sensation of pins and needles, and in some cases what patients call electric discharges, a sudden sharp shooting feeling through the extremities. Patients describe it as walking on gravel that never goes away. As wearing invisible gloves they cannot remove. As a burning that peaks at night and makes sleep feel like additional punishment on top of everything else. And because the standard nerve conduction tests return normal results, they are sent home and told nothing is wrong. If you have nerve symptoms that have no clean diagnosis after standard testing, if you have been told your tests are normal but the burning and tingling are real and ongoing, and especially if these sensations exist alongside joint stiffness and fatigue, you are not describing three separate, unrelated problems. You may be describing one condition introducing itself through three different entry points. Type nerves in the comments if this one resonates. Your neurological symptoms deserve a real diagnosis, not a repeated dismissal. The fourth sign is the one that sends women to the wrong specialist for years, and sometimes to a neurologist, sometimes to a psychiatrist, sometimes to a sleep specialist, when what they actually needed was a rheumatologist who recognized a systemic pattern. The sign is brain fog. Not forgetfulness. Not early dementia. Sjögren's brain fog is a specific and describable experience that patients describe with remarkable consistency. It is the sensation of trying to think through wet concrete. Words that should come instantly take 3 seconds too long, and you can feel the gap where they should be. You are mid-sentence and the thought dissolves before you can finish it. You read the same paragraph 4 times and it simply will not process. You walk into a room and stand there genuinely blank with no thread to pull back to why you came. You know you are intelligent. You have always been sharp. And now something is actively interfering with the signal between your intention and your output. Research published across rheumatology and neurology literature has found measurable abnormalities in brain white matter connectivity in Sjögren's patients experiencing cognitive symptoms. A systematic review published in 2024 confirmed that cognitive impairment in Sjögren's can encompass measurable deficits in memory retrieval, attention, concentration, and executive function, not just subjective difficulty thinking. The mechanism involves neuroinflammation, and some patients show white matter changes on imaging studies that directly correlate with the severity of their cognitive symptoms. This is not imagined. This is not anxiety externalizing itself. This is an autoimmune disease with a documented and well-researched capacity to affect central nervous system function at a structural level. And if you have been told your brain fog is stress, perimenopause, burnout, or depression, and every other explanation has been ruled out, Sjögren's needs to be on the list of conditions tested for. Type brain fog in the comments right now. Because the number of women who type that word is going to tell its own story. The fifth sign is the one I most want you to hear, because it is among the earliest to appear, it is the most consistently dismissed, and acting on it now could genuinely save you years of confusion. It is vaginal dryness and chronic pelvic discomfort that has no clear or complete hormonal explanation. Sjögren's does not only attack the tear ducts and salivary glands. It attacks every moisture-producing surface in the body, including the mucous membranes of the vaginal wall and urinary tract. This is not a fringe symptom or an unusual presentation. It is a well-documented feature of the condition that research has specifically linked to longer diagnostic delays. Studies have found that among Sjögren's patients who waited longer before receiving a diagnosis, vaginal dryness and genitourinary symptoms were among the most significantly reported experiences, suggesting these features appear early and often go unaddressed. Women experiencing this in their 30s and 40s are almost universally told it is hormonal. They are given estrogen cream and sent home. And when the estrogen treatment does not fully resolve the problem, they are told to be more consistent with it, or to try a different formulation. But if the dryness is being driven by autoimmune destruction of the body's mucosal glands rather than estrogen deficiency, hormonal treatment will manage the surface symptom without ever reaching the actual cause. And the distinction matters far more than most people realize, because Sjögren's related mucosal involvement can progress. It can affect the bladder in ways that produce symptoms closely resembling interstitial cystitis. It can extend into the gastrointestinal tract, causing difficulty swallowing, reflux, and changes in gut function. Getting to the root of this early is not a quality of life issue. It is a systemic health issue with downstream consequences. If you have been managing vaginal dryness or pelvic discomfort without a satisfying explanation, and especially if you are in your 30s or 40s and this was written off as hormonal before anyone ran a single autoimmune panel, type dryness in the comments right now. That conversation needs to happen with a better informed doctor. Now I want to pause here and ask you to do something. Give yourself 1 point for each sign you recognized in yourself just now. 1 point means pay attention to how this develops. 2 points means begin documenting your symptoms in writing with dates and patterns. 3 points means Sjögren's deserves to be a specific, named part of the conversation at your next medical appointment. 4 or 5 points means you need a comprehensive autoimmune evaluation, and you need it soon, not eventually. Keep that number in your mind because I am going to come back to it. Before we talk about what to do next, I want you to notice something important about those 5 signs. Joint stiffness, fatigue, nerve pain, brain fog, mucosal dryness. Look at where they live in the body. The joints, the energy system, the peripheral nervous system, the central nervous system, the mucosal surfaces. Not one of them lives in the same body system. A patient experiencing all 5 will typically have seen a rheumatologist for the joints, an internist or sleep specialist for the fatigue, a neurologist for the nerve symptoms, a psychiatrist or neurologist for the cognitive changes, and a gynecologist for the dryness. 5 separate appointments. 5 separate partial diagnoses. No single voice in the room saying these belong together. A rheumatologist experienced in autoimmune disease sees those 5 things as one pattern. Most patients see them as 5 unrelated problems happening to them at the same time. That misunderstanding alone, that failure to see the map, is responsible for years of delay. The 5 symptoms are not competing. They are cooperating. They are different faces of the same disease introducing itself one body system at a time. Now let me tell you what happens when Sjögren's goes undiagnosed and untreated for years, because this is the part most health videos skip over, and it is the part you actually need to understand. Sjögren's is not always a dryness disease. In a significant proportion of patients it becomes an organ disease. The lungs can develop chronic inflammation, a condition called interstitial lung disease, which progresses gradually and is often attributed to other causes before anyone looks at the autoimmune picture. The kidneys can develop a form of tubular damage that impairs their ability to regulate electrolytes and maintain proper kidney function, and this often progresses silently without obvious symptoms until it has been going on for some time. The peripheral nerves can sustain damage that, if left untreated, can become irreversible. The central nervous system can develop neuroinflammatory changes that compound over time. The liver can show abnormal function. And patients with Sjögren's carry a significantly elevated risk of developing non-Hodgkin's lymphoma compared to the general population, a risk that is directly associated with the duration and activity of uncontrolled autoimmune disease. These are not remote possibilities. These are documented complications that become statistically more likely the longer the disease goes without a name. This is exactly why the window you are in right now, the window where you are noticing symptoms but have not yet had a diagnosis, is the most valuable window you will ever have. The question is whether you use it. There is one more thing I need to address before I give you your action steps, and it is the single biggest reason Sjögren's goes undiagnosed even after someone finally walks into a rheumatologist's office. It is seronegative disease. Many people are told they do not have Sjögren's because their blood test came back negative. But research across multiple large patient cohorts consistently shows that somewhere between 10 and 30% of confirmed Sjögren's patients test negative for the most commonly ordered antibodies, anti-SSA and anti-SSB. The disease is genuinely present. The glandular damage is real. The symptoms are measurable. But the antibodies that doctors typically look for are simply not elevated in that patient. This is called seronegative Sjögren's, and it is one of the most consequential blind spots in the diagnostic process. For seronegative patients, the path to diagnosis often requires a minor salivary gland biopsy, a small and straightforward procedure where tissue from the inside of the lower lip is examined for the specific inflammatory changes characteristic of Sjögren's. Research has shown that this biopsy has remarkably high sensitivity and specificity for diagnosing Sjögren's even when blood markers are negative. If your symptoms are consistent with Sjögren's and your blood work has come back negative, that is not the end of the diagnostic road. It is the beginning of a more specific conversation about what additional testing is needed. A negative antibody test does not mean you do not have Sjögren's. It means the most basic panel was not enough. Here is what I want you to do at your next appointment. Write these down. Ask specifically for an ANA, which stands for antinuclear antibody, because this is the broad screening marker for autoimmune activity. Ask for anti-SSA, also called anti-Rho, and anti-SSB, also called anti-La, which are the Sjögren-specific antibodies. Ask for a rheumatoid factor and a CRP and an ESR, which are general markers of systemic inflammation. Ask for a complete metabolic panel to evaluate kidney and liver function. If you have eye symptoms, ask about a Schirmer tear test, which measures how much moisture your tear ducts are actually producing. If your eyes are involved, ask for a referral to an ophthalmologist experienced in dry eye disease. And if your symptoms are consistent and your blood work is negative or inconclusive, ask specifically whether a minor salivary gland biopsy is appropriate. Do not leave that appointment with only a vague reassurance. Leave with a specific next step. You deserve a specific next step. Now go back to that number you calculated for yourself. The number of signs you recognized. 1, 2, 3, 4, 5. Here is the truth about that number. If it is 1, that is worth monitoring. If it is 2, that is worth documenting. If it is 3, that number represents years of your life that a single diagnosis could give back to you. If it is 4 or 5, then this video found you exactly when it needed to. Because the reason I made this video is because thousands of women spend years being told that each symptom is a separate problem. One doctor treats the joints. Another treats the fatigue. Another treats the nerve pain. Another treats the brain fog. And nobody, in any of those rooms, connects the dots. Sometimes the answer is not 5 different conditions happening simultaneously. Sometimes it is one disease introducing itself long before anyone recognizes its name. You are not falling apart across 5 unrelated systems. You may be dealing with one coherent autoimmune process that has been misread as chaos. And that reframe, that single shift in how you understand what is happening, is worth more than any single test result. Because it is what finally gets you into the right room, asking the right questions, to the right specialist, who can actually help you. If you want to walk into that appointment fully prepared, I have put together a Sjögren symptom map that gives you a complete early warning picture mapped by body system, the specific questions to bring, and the test names written out exactly as you would ask for them by name. The link is in the description below. Get it before your next appointment and bring it with you. And if this video helped you finally see your symptoms as a pattern instead of a mystery, share it with one woman in your life who has been told nothing is wrong when every part of her knows that something is. She has been waiting for this video. Send it to her today.